So again, the traditional way is to give you a self-monitoring sheet like these, and we say, go out, track everything you're eating and drinking. So we've developed a system that really counters this idea, and we call it iOTA. It stands for the Interactive Obesity Treatment Approach. And hopefully Apple won't come after me one day for using that little I like that. But the way iOTA works is to say, if you go out and you do these things, if I tell you, don't eat any snacks, get 10,000 steps, don't drink any sugary drinks, and eat 5 fruits and vegetables every day, then you'll have a calorie deficit of 500 calories, and that's enough to produce about 1.5 pounds of weight loss each week. So I don't need you to count calories. I just need you to do these simple things. And some of you are giving me the look that my patients give me all of the time, which is like, seriously, they pay you to tell me this? Right? Like, I totally knew how to do that, duh. That's exactly the reaction we want. Because if it's simple, if it's easy, then people will do it. And when it's hard and it's difficult and it's emotionally charged, they don't. So this will create a 500 calorie a day deficit in a woman who's around 5'6" and 200 pounds. But if you're a man, and let's say you're a little bit heavier, a little bit taller, I might want to create a little bit more of a calorie deficit to get you to lose a little bit more weight. And so what I would do with iOTA is I'm going to change up those goals a little bit. I may change your fruit and vegetable goal to a no fast food goal. I may change another goal to a don't drink any alcohol or moderate your alcohol intake goal. That's always a fun one. And that will get you to 700 calories per day in a reduction. So that's how we get to a caloric deficit. But of course, that's not really satisfactory, right? Because not everybody needs to do these goals. So we need to figure out what kinds of goals do people actually need to do. And then we need to figure out barriers in their environment. If you live in a food desert, like so many people here in Boston do, and I make a recommendation that you replace your snacks with fruits and vegetables, we have a problem. So I need to understand what the barriers are. I then also need to think about your motivation, because unless you're sufficiently motivated, you're not making any changes. So I need to look at that too. We've created algorithms that take all of these considerations into account, and we've put them in the cloud. And what that allows us to do is that our patients come in and they use one of our technologies to fill out a short survey. It can be like a web-based survey or something on a phone or a text message or even a phone call. They fill out a survey where they tell us about their needs and their preferences and what they're doing and what they're not doing. It gets run up against some of our algorithms. Our algorithms then reach into a large library of these totally common sense, obvious goals. And we know how many calories each one is going to produce for a person of certain height and weight and all of that. And then we give a person a series of 4 goals to work on. We say, go out and do these 4 things. These have been personalized for you. And that's the key part of iOTA. We then ask people to self-monitor their adherence to those goals. So we say, every day, tell us how well you're doing reaching these 4 goals that we've set for you that are highly personalized. And we touch people with our self-monitoring interfaces in computers and over the telephone and text messaging, email, anything you can imagine. And this is one of our text messaging programs. You can see it's really simple. They just got this little text message every day, and it says, here are your goals. How well are you doing on each one of these goals? Tell us. And so somebody would type this in, and then she presses send. And when she does that, she gets feedback immediately. It's highly personalized. And what we see is that over time, you do this day after day after day, the system gets to know you better. And we continue to personalize this experience for people. We also teach people skills about dietary change and weight loss through these technologies. We link them up with coaches. And this approach has a lot of advantages. iOTA has a lot of advantages as a digital health strategy. We can do lots of things. We can personalize the content. We can link people with their coaches, with nurses. We can link to wearable devices. But the thing that makes this all work is the fact that all of us and all of our patients carry their phones around all the time. And so it's easy to touch people with this kind of content.